You'll excuse me if I speak in English. My Tamil is not very good. In fact, it's rubbish. I would just like to say, so as Rafai says, I work at a place called the Essex Cardiothoracic Centre, which is just north of London. And we deal with a population of around 2 million people. And we're a specialist cardiac centre. But we're also a part of a very large hospital that has other specialities that you would expect, like accident and emergency physicians, surgeons, pediatrics, obstetrics, etc. So we're a specialist cardiac centre in the middle of a big hospital. So not dissimilar to Apollo. The reason that I've come out to talk to you today really is to talk about cardiac arrest patients and those patients who unfortunately have a cardiac arrest outside of hospital. Now, this is a very important group of patients, and often it's not unusual that this group of patients are quite young, and they can also be very fit and well up until the point that they have their cardiac arrest. So they're patients that are leading good lives and enjoyable lives up until that point. And what we've noticed in the UK, and certainly what we've noticed in Essex, is that the chances of survival from out-of-hospital cardiac arrest have improved from around 10 or 20% to 60%. So I'm here really to talk to you, and I hope persuade you to take on the model that we've developed in the UK and in Essex, so that here in Chennai you can improve the survival rates for these patients from probably 5 or 10% up to 60%. Now, how do you go about doing that? Well, there are two key components to this, and those components are what happens to that patient before they arrive in hospital, and the second component is what happens to these patients when they get to hospital. And if I take the second component first, because I think perhaps for this audience it's very important, the way that we have improved survival for our patients in Essex and in the United Kingdom is to make sure that the appropriate patients are brought directly to a major cardiac centre like ours. And why does that matter? Well, the reason that matters is because when you bring them to a major cardiac centre and a major hospital, we have all the expertise and all the facilities that we need to give that patient the best chance of survival. And what are those facilities? Well, the most important facilities that we have are people and experts. So we have a fantastic team of doctors and nurses and other healthcare professionals that are expert at dealing with these patients. In particular, we have an expert team of cardiologists, expert intensive care doctors and anaesthetists, and where we need them, expert surgeons as well. And what this translates into is almost like, if you like, almost like a Formula One team in the pits. So when the patient comes through to us and in, all of the team are there, all of the facilities are there in our cardiac unit, in particular in our cardiac catheter labs, to enable us to take that patient who is extremely unwell at that point and be able to make a rapid diagnosis of what the cause of the cardiac arrest is, and then treat that cause rapidly. And I think, although my Tamil is not good, I think I heard someone talking about the golden hour. Yeah, the first hour that you see, that the patient is in the hospital is absolutely critical. You've got to get the diagnosis made and the treatment given within that hour to maximise the chances to get that survival up to 60%. And the important thing is that we know that with the type of patients that I'm talking about, the vast majority of those patients have an underlying heart problem, an underlying cardiac problem. And the most common cardiac problem that these patients have is coronary disease. They have blockages in their coronaries, and often a very sudden and complete blockage of a coronary artery leading to a heart attack. And it's that heart attack that then leads on to cardiac arrest and the patient collapsing unconscious. And so, bearing in mind that most of the underlying causes for cardiac arrest are cardiac, it makes perfect sense to bring those patients to a unit that has expertise in cardiology, because you will then maximize the chances of that patient in the first hour surviving, and you will maximize therefore the chances that they will leave hospital like me and you, walking and talking, without any significant neurological injury. The other important thing that you will need, and where I'm told that Apollo has great strengths, is the facilities that you need and you have to manage these patients after their cardiac arrest. So I'm talking about intensive care. I'm talking about strategies that you need to implement to reduce the chances of significant brain injury, which is one of the reasons why some of these poor patients pass away. And so it's not just a cardiologist that you need, but you will also need your intensive care doctors. But in a way, because we see so many patients now with out-of-hospital cardiac arrest in Essex, maybe 3 or 4 every week now, so 150 to 200 a year, we ourselves as cardiologists have actually become experts with brain injury as well. And there's no reason why you, Rafai, and your doctors wouldn't be the same. In fact, in a way, we have more expertise at brain injury than our neurologists do, bizarrely enough. But this is a very important component. And then finally, all I would say is that obviously the pre-hospital phase is very important. And I think, Rafai, you were mentioning to the audience about the importance of cardiopulmonary resuscitation and life support. And there is a chain of survival. You've got to get that right first and then come to an expert hospital like Apollo. So with that, I thank you for listening, and I'm more than happy to take any questions.
We will have the question and answers later, Doctor. You can introduce the patients. He can be. Make your patients come.